You have a queue that you work through, different members. You're reaching out to them, going over all their medical conditions, their meds.
At the start of the day, we usually organize that work queue, looking at cases that can be closed, consumers that need to be called, consumers that are, a third try, and kind of just organizing it that way.
We have meetings that we bring cases to the medical director to discuss what we could do better, what we could do differently, just to help these members. And, basically it's on the phone and taking calls and making calls.
The main tools with the telephone and the computer. On the computer, we have a lot of resources on there, assessment tools that we can look at. A lot of them are specific information on what's appropriate and what to ask the consumer.
The biggest difference is probably just the visual, and you have to pick out what they're saying, how they're saying it, their tone of their voice, rather than actually looking at them and seeing their verbal expressions and their behavior.
I think after you get comfortable with that, which it takes a little bit, but you really are more aware of those cues and clues to listen for and try and assess them over the phone. Changes would be the biggest challenge. It's a big company. Employers that purchase our services want certain things, and based on what they want, changes are in effect. And so monthly, we have our training that we go through, and that updates on what the changes are, but there are definitely a lot of changes, and you have to be able to adapt to that quickly.
Least favorite part about my job is probably the fact that a lot of members, you leave messages for them, and so it's a lot of leaving messages and not connecting.
The best part is when you reach the consumers and you impact their lives and they say, yeah, I went to my doctor and I asked them about this medication and you were right, they should be on it, or thank you for that information, my blood sugars are now within normal limits, or my asthma's under good control, or I lost 10 pounds, or I quit smoking. That positive impact on the consumer's life is so rewarding.
I sincerely work with a great group of people, mentors, managers, management. Everybody has been, it's very professional. It's very easy to talk to anybody with any questions or concerns. We reach out to members of certain groups and help them understand their disease processes and help them to enable to understand how to manage them and provide resources that are available to them through their insurance.
Basically just making sure that they have the knowledge in order to have their medical issues under good control. The more knowledge they have, the better care they take of themselves, the less the healthcare costs.